Well, hi everyone. It's Angela Gill at the MHP Foundation. If you've been reading your emails and watching Facebook, you know what's going on with these videos. But just in case you haven't been, we're doing a series of interviews throughout the month of December for our end of year fundraising campaign. And we've chosen to fundraise for projects that different staff members have come up with. They have their own campaign at the hospital where employees give money for these projects and other things that we do. And we decided to go ahead and invite the public to participate in these projects too. I'm here with Sophia Keith. She is an RN and a certified diabetes care and education specialist. And one of our projects, and Sophia has a lot to do with this, is to we've given $3,000 to this department to purchase meters, testing strips, other diabetes monitoring supplies for patients that can't afford those. And believe it or not, that's pretty important. So Sophia is here to talk to us about that and what it means to people. So you are a certified diabetes care and education specialist. What's that mean? What does that do?
Yes, so certified diabetes care and education specialist can be registered nurses, registered dietitians, pharmacists. We attend some more specialized training and receive our certification in diabetes so that we can offer education, support, troubleshooting, specifically for our patients with diabetes, just to help with the overall management of their diabetes. We don't assume the care, we don't take over the care of our patients, but we help their primary care doctors or endocrinologists delve in a little more deeply into what might be going on with their patients and see what we can do to assist.
Yeah, that's neat. So it's a little extra support for the patients. And so if someone has diabetes and they're coming to see you, how often might that be that they would come and see you?
So we recommend any person who's been diagnosed with diabetes come see us upon diagnosis. Typically that could be 3 sessions, 4 sessions. They'll meet with me, they'll meet with a registered dietitian, really is individualized per the patient's needs. But we also recommend that people come back to see us with any significant transitions in their life, starting new medications, anytime that they've had a recent change that is affecting their diabetes. Insurance typically covers diabetes education very well, so we recommend people just come back even yearly if they just want a little refresher.
That's nice. That's really good. It's just a little extra support. About how many people do you see in the diabetes clinic a day?
Between me and my cohorts, Lacey Harness and Lisa Schnepp, we see upwards of maybe 20 to 25 patients from day to day. That varies a little bit.
But that's quite a few people every day between the 3 of you. About how long do you spend with a patient?
Most of our sessions are an hour long. So our initial visits are going to be an hour. Sometimes our follow-ups are a little bit shorter than that, but it takes a little bit of time to really delve in and figure out what's really going on with the patient's diabetes management.
And you kind of get to know each other a little bit too, I think, probably. Yeah.
That's so important.
What is it that's so important about monitoring diabetes? I mean, why does it even matter that you monitor?
That's a great question. I get asked that a lot by patients. I think monitoring blood sugar, especially when it involves poking fingers, is probably one of the least favorite things that people, are asked to do when they're diagnosed with diabetes. But in order for the patient's provider to make informed and safe decisions about their plan of care, about their treatment, they have to know and understand the patterns of what the blood sugars are doing. So I hear this all the time. For example, a patient feels like their blood sugar has been pretty steady for a while, so they just stop testing. They take little breaks, and then before they know it, at their 3-month follow-up with their doctor, their lab work, their A1C, their average blood sugar has gone higher. And maybe if they had been testing, they would have noticed that trend going up a lot sooner and could have gotten an earlier intervention to bring it back down. We have to know where the patients stand with their blood sugar in order to know how to best help them.
So it's really important then to
Very,
monitor. Yeah, very important.
very.
What happens if someone doesn't monitor or can't monitor? Maybe they can't afford their test strips and so on. If your sugar gets out of control and you don't take care of it, what are the risks that you run?
So there are some short-term risks and some long-term complications of diabetes. Short-term, I'd say worst case scenario is somebody comes into the hospital very sick with DKA, or diabetic ketoacidosis, where their blood sugar has just gotten very, very high, and it takes a big toll on their body. Sometimes that's an ICU stay. It can affect their vision. It can make their wounds, their bruises slower to heal. It's harder to fight off infection. They can develop nerve damage, kidney damage, increases their risk for cardiovascular disease. So we certainly emphasize in our clinic the importance of quality of life. And if we can bring those blood sugars down and better manage diabetes, we see an overall reduction in people's risk of developing those problems that keep them having to go back to multiple doctors and keep them on a bunch of other medications, or, you know, being in and out of the hospital, those things that just nobody really wants to be, you know, a part of their life.
And it seems to me like once that starts, you get in that cycle, it's really, really hard to get out of it.
It can be.
Yeah.
It can be. It is a vicious cycle when people are, you know, just overwhelmed with so many different problems with their health. It is a lot to manage.
Mm-hmm.
Diabetes alone is a very complicated disease process to figure out. But when you add in heart disease, high blood pressure, high cholesterol with it, before you know it, patients become very overwhelmed with all of the doctor's appointments and the medicines and the things that they're being asked to do.
It'd be really hard to take care of yourself. It'd be really easy to just say, I'm not going to do it. And then you really end up in trouble. Yeah.
Yeah.
Really
Yeah.
Mm-hmm. So being able to provide those meters and those strips to patients is going to be a great thing for you.
Absolutely.
Yeah.
Yes.
And I would think it's probably going to be good on both sides, because you'll be able to give them the supplies and you'll feel good about that, and they'll have their supplies and they'll feel good about that. So it's just,
absolutely, yes.
Diabetes is complicated. I did not realize how complicated it is. It's not just a little sugar, like sometimes like people
I know.
say. Yeah, a little sugar. Yeah. Well, I hope I never get it. But if I do, I think coming to see you would just be delightful.
Oh,
yeah, I mean it. And this
well, thank you.
fun, and I appreciate you taking the time to talk about it with us today, and tell us why monitoring your diabetes is important. And I hope that this will encourage people to watch out for their own health, and to think about making contributions to the MHP Foundation to help support these kinds of projects. So
we appreciate that so much. Diabetes is an expensive disease process, and any help that we receive is so very much appreciated. Thank you.
Thank you, Sophia.